I've been in hair restoration for over 34 years now, and I get asked all the time different questions about hair and hair loss. And many times it's by young patients who have a family history of hair loss and they're really scared about what's going to happen to them. What should they do? Should they get a transplant right away? Is it better to get it sooner or later? Well, the most important thing is to have a good plan, to find someone who can tell you what's the best treatment for you. Most patients, it's preventative. You want to have good scalp and hair care. You want to do things that are either topical medication, some laser therapy, sometimes it's oral medication to preserve the hair that you have. You don't have to jump into transplants right away, but hold on to the most amount of hair that you have. That's going to give you the best result. And then have a long-term plan and be with someone that you're comfortable with so that as they recommend the various stages, you can be in agreement with that plan with them.